The dark history of mental health treatment at Bedlam. The history of mental health treatment, particularly in institutions like Bedlam, is marked by profound cruelty and inhumanity. During the centuries when Bedlam Royal Hospital, often referred to simply as Bedlam, was in operation, psychiatric patients were subjected to a wide range of brutal, dehumanizing practices that were based on limited understanding of mental illness. The treatments often bordered on outright torture, with little regard for the well-being of patients. One of the most common forms of punishment and control used on patients at Bedlam was physical restraint. In the absence of effective treatments, patients, especially those seen as violent or disruptive, were often shackled and confined to cells. Restraints such as iron chains and manacles were applied to prevent patients from moving freely. These restraints were frequently left on for extended periods, days, weeks, or even months, leading to significant physical and psychological harm. Patients were also often placed in small, dark, filthy cells where they could be left without proper food, water, or care. The dehumanizing nature of this restraint not only caused physical pain, but also contributed to the isolation and suffering of those confined. In the early centuries, mental illness was often thought to be caused by an imbalance of bodily fluids, a theory dating back to ancient Greek medicine. Doctors believed that bad humors, too much blood for example, were the root cause of psychiatric disturbances, and one way to restore balance was through bloodletting. Patients were subjected to leeching, cupping, where heated cups were placed on the skin to draw blood, and the use of lancets to make cuts in the skin, draining blood to purify the body and mind. In addition to bloodletting, patients were also frequently subjected to purging, a process that involved inducing vomiting or diarrhea in an effort to cleanse the body of its perceived impurities. Both of these techniques were painful, invasive, and often made the patients weaker rather than providing any therapeutic benefit. For those seen as particularly unruly, doctors and attendants at Bedlam would resort to physical punishment to maintain order. Flogging or whipping was a common form of correction. Patients who were deemed disobedient or violent might be stripped and whipped, sometimes in front of other inmates, to reinforce a sense of control. This form of corporal punishment was considered an acceptable means of dealing with perceived misbehavior in psychiatric institutions during this period. In some cases, patients would be beaten for attempting to escape or for exhibiting any signs of aggression, adding to their suffering. The punitive approach to psychiatric care not only deepened the physical trauma of the patients, but also reinforced the stigma and dehumanization surrounding mental illness. In more extreme cases, doctors would resort to procedures like trepanning, also known as trepanation, or lobotomies, which were often performed in an attempt to cure psychiatric patients by altering the structure of the brain. Trepanning involved drilling or cutting a hole into the skull to release what doctors believed to be harmful pressures or spirits trapped in the brain. It was thought that releasing these pressures would cure a range of mental illnesses, from depression to schizophrenia. The procedure, which lacked anesthesia, was incredibly painful and had a high risk of infection or death. While trepanning was more commonly practiced in ancient and medieval times, some forms of lobotomy, a surgical procedure that involves severing connections in the brain's prefrontal cortex, emerged later in history. Though lobotomies were more associated with 20th century psychiatry, the brutality of these procedures is not far removed from the methods used in earlier centuries. In fact, both trepanning and lobotomies represented a gross misunderstanding of the causes of mental illness and were often performed without the patient's consent. Another form of torture used at Bedlam was the cold bath treatment. This was a method in which patients were submerged in freezing cold water for extended periods, believed to shock them into mental clarity. However, it was often used as a form of punishment or control, with patients left to shiver in the cold for hours or even days. There were also reports of patients being subjected to drowning or near drowning as a way of calming them. In extreme cases, patients might be held underwater in an attempt to reboot their mental state, a brutal method that could easily lead to injury or death. While electroconvulsive therapy, ECT, as it is known today, did not come into practice until the 20th century, the concept of using shock as a means of controlling patients was not new. In Bedlam's early years, doctors experimented with methods such as electric shock or the use of convulsions to attempt to cure mental illness. These procedures were seen as a form of retribution or control rather than any form of legitimate medical treatment. The idea was that inducing physical shock or seizure-like episodes could disrupt the patterns of behavior seen in patients suffering from conditions like mania or agitation. These techniques were not only physically damaging, but also left emotional and psychological scars. Perhaps the most insidious form of torture at Bedlam was social isolation and neglect. Many patients were kept in solitary confinement for years, with little human contact or sensory stimulation. This form of extreme isolation was used as both a form of punishment and a treatment for mental illness. Even in the 18th and 19th centuries, when reform efforts began, neglect continued to be a pervasive issue. Patients often lived in squalid conditions, with overcrowding, poor sanitation, and a lack of basic care. Such neglect led to physical ailments like malnutrition, infections, and even death. The history of Bedlam is a dark and tragic chapter in the story of psychiatric care. The inhumane practices endured by patients, from physical restraints and bloodletting to trepanning and neglect, reveal the utter lack of compassion and understanding that dominated the treatment of mental illness in earlier centuries. These barbaric techniques reflect the ignorance and cruelty of a time when mental health was little understood, and those who suffered from psychiatric conditions were often treated as less than human. Today, mental health care has evolved, though the scars of Bedlam's history remain a haunting reminder of the mistreatment that psychiatric patients endured for centuries. The legacy of institutions like Bedlam calls for ongoing reflection and reform to ensure that the dignity and humanity of those with mental illnesses are respected.